Brachytherapy is a type of radiotherapy, and we sometimes refer to it as internal radiotherapy or intercavitary radiotherapy. Because we deliver the x-rays internally, we aim to give a high dose of radiotherapy to the cervix, but limit the dose to the internal organs which surround the cervix, such as the bowel and the bladder. So different cancer centres will have different schedules when it comes to brachytherapy. Here at Clatterbridge Cancer Centre, we normally deliver 3 treatments of brachytherapy in total. This is normally done after 5 weeks of your chemoradiotherapy. Towards the end of the 5 weeks, we do a scan to assess your response and determine whether brachytherapy is a suitable treatment for you.
The brachytherapy team is a small team. It has a team of nurses, a team of doctors, a team of radiographers, an anaesthetics team and a team of clinical scientists. Your brachytherapy appointments will be booked alongside your radiotherapy appointments, so you'll receive additional letters for these. There are a few appointments that you have to attend prior to your brachytherapy. One is an MRI scan, which will be in the 5th week of your radiotherapy, and the other is a preoperative assessment, which will let us know if you're fit enough for anaesthetic.
So before you come in for your procedures, we will expect that you'll have been fasted. So what that means is that we expect that you've not had anything to eat, normally from midnight the day before, and some just to drink water following that. The water can be drank up to 2 hours before you come in. So normally the procedures will be done as a day case, so that means you'll come in the morning, you do spend the full day with us, and normally by tea time-ish you're ready to go home. Sometimes we may need to keep you in, there may be clinical reasons, we could decide that beforehand, but sometimes it's on the day. So we do ask that you bring an overnight bag in with you. In the morning you will be brought straight into your own private room. You will have a nurse per patient, so they'll be able to admit you. They'll ask a lot of questions that probably a lot of people have already been through already, and some of the other preparation is that we do expect that the patients have an enema. The reasons for that is we like to get rid of any gas, but just anything else that may be left in the bowels. We'll come to the theatre suite, which is right next to the bedrooms. You'll be taken into theatre or the anaesthetic room, and you'll be checked in by the anaesthetic team, which you've already probably met. They'll go through similar questions again before they put you under anaesthetic. So the anaesthetic actually is only about 30 to 40 minutes, where you will have your applicator inserted as well as a catheter. And then once that is complete, you will be woken up in recovery. We will make sure that you're fully recovered from your anaesthetic. You will, however, have to lie flat for several hours following this because you will have your applicator in situ. Our team will then escort you down for your MRI scan, and following that you will be brought back into your private bedroom. In the bedroom again, you will have to lie there for a long period of time, but we make sure we give you pain relief and we'll give you plenty of food and drink if you feel up to it.
An MRI scan will be taken after you've recovered from your anaesthetic. We'll take you down to the MRI scanner, which is 1 floor below us. The MRI allows us to have a look at the position of the applicator and also allows us to plan your treatment. The brachytherapy planning will be done by your doctor and some clinical scientists. They will draw around the area that needs some treatment, and they will protect all the areas that don't need treatment. Once your treatment is ready, you'll be taken into the treatment room, and there'll be 2 radiographers and a nurse in there. We'll connect you up to the machine. The machine has a small radioactive source that will travel down a tube and into the applicator that's inside you. Once the radiographers are happy, they will leave the room and watch you from the cameras outside like they did during your radiotherapy. If at any point you need us, you just need to give us a simple wave and we'll come straight back in. Once the treatment's finished, a radiographer and the nurse will come in to remove the catheter and the applicator, and we'll give you pain relief.
Once you're feeling okay and you're up and about, we ask that you pass urine and then you're free to go. Side effects from brachytherapy affect people differently. You may feel tired and weak, and it's important to rest in between appointments and after your treatment. We'll talk to you in detail about any potential side effects, but if anything is causing you concern or anxiety, do let us know. We're happy to talk about it.
Once you've finished brachytherapy, we will arrange a follow-up consultation after a few weeks to ensure you continue to recover and plan your next steps in your management.